This 73-year-old patient was referred to us by her son, who is a general dentist, for endodontic retreatment of tooth number 18. According to the patient, who happens to be a dental phobic patient, extremely dental phobic, this root canal was done many years ago. Recently, according to the patient, the tooth started to hurt. Patient described the pain as an ache, constant ache, and described it also as pain in her jawbone and below the tooth. And looking at the radiograph here, you can see why. You can see periapical relucency, a large one associated with the mesial roots of this tooth. Porcelain crown here. That's a fiber post. And take a look at the shape of the canals, the way this dentist shaped these canals. Looks like very likely he used Gates Glidden drills. Gates Glidden drills in this day and age have no place in endodontics. And you can see why I say that. As you can see, this is a Coke bottle shaped prep. A lot of dentin was taken away unnecessarily by using these Gates Glidden drills that are extremely aggressive. And you can see the canals, the walls were so thinned out. So we discussed options with the patient, and patient definitely wanted to try to save the tooth. And that's what we did today. Today went ahead and IV sedated her. It's a female patient. Went through the porcelain crown, no damage to the crown. And these were thermophil obturators or carriers. So remove two of them. This is one of them. The other one got suctioned out. As you can see, this is one of them. The other one was suctioned out. And by the way, we did selective endodontic retreatment in this case. As you can see, the distal root is clean. No periapical relucency associated with the distal root, so why mess with it? If I was going to mess with this root, which again it would have been unnecessarily, I would have had to remove this fiber post and try to remove this plastic thermophil carrier that was cut very deep into the distal canal there. And I might have even pushed that out of the root, so causing more complications, again, for no reason. As you can see, the root canal was done many years ago, according to the patient. No periapical relucency is associated with the distal root, so why mess with it and complicate things for us? So we focused on the mesial roots, mesial canals only. Remove the two plastic thermophil obturators, and I have a bunch of videos showing how I do it. In a nutshell, I use edge files. I engage these carriers, plastic carriers, with edge files, and I just yank them right out of the canals. All right, so take a look at the post-op. And here's the post-op. As you can see, everything went beautifully. And per her request, because she has dental phobia, we also placed a permanent buildup, just etched, bonded, and used posterior composite and did the permanent buildup as well. So she doesn't have to go back. Because of her dental phobia, she would have had to otherwise gone back to her dentist and endured some pain and suffering to have my temporary filling replaced with a permanent filling. So we decided to do that ourselves while the patient was under sedation, IV sedation. As you can see, everything went beautifully, and I'm optimistic about this tooth. I believe the infection associated with the mesial roots will go away. Hopefully patient will come back in 6 months for a post-op, and I will make a video and post that.